Hi, my name is Corey Minter. I'm the president of Trinity Employment Specialists. And Trinity specializes in staffing in the medical field. We staff for every position that you can even imagine in the medical field. And one of the main positions that we are constantly having to really put a lot of effort into recruiting for are for LPNs. And here's a primary reason for it. There are a couple of reasons for it. Most of the hospitals have stopped using LPNs, and they've moved everything to RNs. And that happened about 4 or 5 years ago. And now it seems as though they're starting to try to bring back LPNs into the hospital. But what happened as a result of the hospitals stopping of the hiring of LPNs is that the schools who trained LPNs really put the brakes on trying to get LPNs certified or registered. And that is one of the reasons, is because the schools have slowed down, especially when the hospitals did. But all of the LPNs that used to work in the hospitals then moved over into home health care and private care and long-term care facilities. So these type of facilities utilize LPNs regularly. And to be quite honest with you, they pay them a good deal more than what the clinics and the hospitals have the ability to pay. So there's a really big trade-off when we hire an LPN. The first thing is that we need each one of these LPNs to have actual experience in a clinic. There's a large difference in between providing service and providing care for a long-term care facility or a nursing home or that sort of facility versus a medical clinic. In a home health care or long-term care facility, you're going to be there with the patient every single day. It's probably going to be a much slower pace. And because of the amount of money that those facilities are getting paid right now, those facilities are able to afford a much higher salary. But if you go over into the clinic, it is a complete different ballgame. You're going to be rooming patients, taking care of patients, assisting the physician in the back of the room with real medical procedures. Whereas in the long-term care, in the nursing home type of scenarios, you're really only going to be providing the basic needs, dispersing of medication, and that sort of thing. So there's really a complete different set of responsibilities for each one of them. And so for every LPN, most are in a home health care or a long-term care facility. So we are always looking for anyone who has any kind of experience in home health, in a clinic type setting. If you have some experience in a clinic type setting, it's going to be much more relative to what the hospital needs. But because of this shortage of LPNs, and now the hospitals and the clinics are now seeing a desire to bring them back in, there's a large shortage. So it's something that was a long, long way of trying to say that we are constantly recruiting for good, solid LPNs with clinical experience. And it's really important that we find someone with a good, solid work history. It's no problem at all if this individual has experience in the long-term care facilities and home health care, but it's extremely important that they have some kind of clinical background so that they have a decent understanding at what it is, because it's very possible that someone who has not worked in that clinical type setting really just wouldn't like it, and it's not in our client's best interest to let them try to figure out what what they might want or if they would like the clinical setting while they're training them. That's not the way that they're going to want to work on it. And so this is something that we're constantly looking for. We also need someone who is an A player, someone who shows up to work, works well with others, works positively with others, leans in towards positivity, focuses on the work and not the drama type circumstances that can be known to happen in medical clinics. We really want to try to find a top-notch individual for 2 of our clients at the moment. And if you happen to know of someone, or if you are an LPN that has this type of background, we would really love to speak with you. If you could give us a call at 918-622-2588, we'd love to talk with you. Thank you so much.